Hi, everybody. This is Andrea Paquette, president and co-founder of the Stigma-Free Society. Thank you for joining us today on our Facebook Live. I am really excited because, as you know, the Stigma-Free Society is about the elimination of stigma, focus on mental health. We have many partners and wonderful people that we connect with. And today we are talking to Dr. Shimi Kang. How are you doing today?
I'm great, Andrea. Wonderful to be here. I'm so grateful for the work that Stigma-Free Society is doing. I definitely see it up close in the patients I work with in the community. So congratulations on all your great work.
Oh, thank you so much. And I'm really happy to be here today to talk about all the great work that you are doing and Dolphin Kids and everything to do with wellness of youth and mental health. So it's very exciting to have you. I'm going to share a little bit about your bio and just so people can get a sense of who you are. So Shimi Kang, she is an award-winning medical doctor, researcher, and expert on the neuroscience of innovation, leadership, and motivation. Dr. Shimi Kang provides science-based solutions for health, happiness, and achievement in the workplace, the classroom, and at home. She's an author of the #1 bestseller, The Dolphin Parent, pick up a copy, and The Tech Solution as well, creating healthy habits for kids growing up in a digital world. She is also the founder of Dolphin Kids, Future Ready Leaders, CEO of Spark Mindset app, and host of the YouTube show Mental Wealth with Dr. Shimi Kang. So now that we have gotten to know you a little bit through your bio, I always like to throw it over to the guests to share a little bit about yourself and just basically, first and foremost, just why are you passionate about this topic?
Yes. Well, you know, it's interesting. I think I feel my neural fingerprint is for the human brain. I've always been fascinated by how the brain works. When I was 8 years old, my older sister, who's a science teacher, had a model of the brain. And I actually asked for one for a birthday present. And it's actually right here. So here you go. I've had this since I was 10 years old, and this has been with me. So it's just one of those things I think I was born to do. And that really what led me to become a psychiatrist. And then within that field, I really realized the big gaps were child and youth. And I also felt the biggest opportunity was child and youth as well, because if we can set habits and coping skills early prevention and early intervention are really the keys, I believe, to the mental health crisis. So that's where after 17 years at Children's Hospital, where I had a long waiting list, I felt it was really important to try to get out into the schools and into the community. And that's what led me to write my books and found Dolphin Kids. And I'm also a mom of 3. So I find that, of course, seeing my kids, of which one has ADHD and learning differences, and my daughter has dyslexia. Really, I've had that experience as a parent in navigating our system as well.
Okay. Well, I understand that you have an amazing event coming up today, and I have you till 12:45, but there's some really important questions I'd like to discuss with you. And as the school year ramps up, can you share a little bit about the trends you're seeing in youth mental health in regards to the COVID-19 pandemic and in-person schooling?
Yeah, absolutely. I think probably the best stat is to quote a survey done by CBC of Canadian teachers, because they're, of course, up close. And 90% of Canadian teachers said that student mental health was their primary concern. Now, that's really important given that, there's been academic delay as well. So what I'm seeing is a lot of anxiety, of course, and in those that are younger, not vaccinated, but also the older kids who still have to wear masks. And many are, we've seen rates of social anxiety that were already going up. And now kind of being outside of social situations, hiding behind a mask or a Zoom, being in person can really spark that social anxiety. We know that screen time has gone up, and video game addiction and social media addiction. I think getting kids off screens is going to be a real challenge. There's germophobia, where the kids have phobias, and now there's something to be really scared about. So that's also one thing. And then in the adolescence, something called hypersociability, meaning they're wanting to now connect more, party, spend time together. And we're seeing upticks in drug and alcohol use in that group.
Interesting. You're so well versed in this area, and I always love talking to you about this topic. And I was wondering, Dolphin Kids, I know about Dolphin Kids, but our audience may not. So what inspired Dolphin Kids? Tell us about it. And as well, specifically about the counseling services. This is what I'm really curious about.
Right. So Dolphin Kids started about 6 years ago in my basement with a group of passionate child development experts, including teachers, counselors, psychologists. And it's really about social, emotional, cognitive learning. So, these are the life skills that we know lead to successful kids. So good social skills, learning how to conflict resolution, learning how to problem solve, communicate, good emotional regulation skills, awareness, really managing self-regulation, and cognitive skills, critical thinking, thinking out of the box, problem solving. So that's what Dolphin Kids teaches through a variety of camps and themes. We have fun themes like art and science and TEDx speaking and entrepreneur mindset. So those are our camps and programs. But recently we expanded to a counseling division for counseling, psychology, and nutrition. And this is really to address the long wait lists out there for therapists and counselors to deliver directly to young people. And it's actually the new aspect of the model is it's supported by me as psychiatrist. So we have weekly rounds and we talk about our cases. And that's quite unique in the sense often people are in silos, the therapists and psychiatrists. So we're hoping that it really reduces the load on the wait lists out there and what families and kids are dealing with right now.
Nice. I love that innovation and taking the services of counseling with guidance of your psychiatric care. That is unique, isn't it?
Yeah, I don't know of a lot of programs. Actually, programs that really do that from a counseling point of view. As a psychiatrist for almost 20 years, it's hard for me. I learned that if I wanted to talk to my patient's counselor, I had to book an appointment. I had to find the time in their schedule and my schedule. And it was really not an easy thing to do to communicate. So that's where this model really came from, is noticing that's a gap. We need to really look at young people and their families holistically and multidisciplinary and work as a team.
What do you hope to achieve with that model? It is unique and innovative. What do you hope to achieve with it?
Well, I hope that actually, in a big picture way, I hope to see people copy it and really realize that, this is doable and we can have cross multidisciplinary connection and communication. But for the individuals, I just think what I really hope for with the counseling services that I've seen it, sometimes people go and they get turned off or they haven't learned the skills that they need. So, I'm hoping that it accelerates the recovery, accelerates the learning, it accelerates the development of coping skills and life skills, because we're very focused on problem solving. So it's not as open-ended, it's really specific, and everybody leaves with learning at least and practicing 3 coping skills each session.
Right, those concrete avenues to actually taking those tools home with them, right?
Yes, and it needs practice, and you need guidance. So it's going to be something that we've already started, and we've already seen the benefits of the cross section. And in our rounds, the nutritionist may not be the professional involved in the case, but can give really good advice. So people and we're getting advice from other professionals for our clients, which otherwise we wouldn't have, just from that collaboration and communication.
Okay, interesting. And I mentioned the Spark Mindset app, and I was very curious to hear more details about this app. Did you want to share about that?
Right. Yeah. So Sparky is a neuron. It's a character. And the app is a digital app that's available right now. Actually, you can download it for free off any mobile Android or iOS phone. It's designed to help children generally under the age of 10 with mindfulness practices, connection and bonding practices, and play or play-based problem-solving practices. Each practice is less than 7 minutes, and it's guided by Sparky and Sparky's friend, Professor Light. So it's really engaging for young people. And every aspect of it, we really brought in the science of how to engage children. But, of course, it's hard for them to do breathing and mindfulness exercises. So we wanted to make it fun. And Sparky is the one with the problem. So it also builds empathy for the user. Now, I did write a book on technology, and it is important to recognize that we want tech that is healthy, right? So that's why the exercises are short. Many of them are audio only, so children can close their eyes, so they're not exposed to the blue light. And it's being used with a trusted adult. We're having trials in some schools across Canada right now with teachers using it. So it's something that can be used by a parent, by a teacher, or a trusted adult with a child. I really hope people try it because it's been so much fun, and Sparky's a really fun character. His dendrites move when you use the app.
Nice. Spark Mindset app, correct?
Yeah, Sparky.
Yes. Okay,
exactly.
Sparky. Yes, and that's the little blue guy. All right. Perfect.
That's
yeah, he's very cute. So as we're talking about technology, how can it play a part in positive mental health? Like, I know overuse and is a great concern for parents and caregivers. So is there anything else, like using this app? Like, that's a very positive technological opportunity. Is there anything else that you feel may be useful in that realm?
Right. Yeah. And it's important to show children at a young age that tech can be done in a healthy way, because we have that saying, neurons that fire together, wire together, meaning if they experience healthy tech early, they're more likely to use tech that way. Whereas if they consume the junk tech, the sugar, then they're more likely to use tech for entertainment. So there's some great other products out there. BC Children's Hospital and Kelty worked on an app called Breather, more for teenagers. That one's great. There's an award-winning app called Calm Harm for self-harm behaviors. And then, of course, there's the ones that are very popular, Headspace and Calm, that a lot of adults are using. There's so much technology for mindfulness and meditation now. But I also want to say tech that allows people to look and see each other is really important. That releases oxytocin. That's a natural antidepressant and very powerful for our brain. And then, of course, tech that is creative. So I tell families, instead of watching TikTok videos, make a TikTok video if your child's interested. Obviously, you have to, think of safety, but being creative, trying new things, whether it's photography or coding or robotics, there's so much healthy aspects. So in the Tech Solution book, I say healthy tech is tech that leads to self-care, creativity, or connection. So the 3 C's of healthy tech.
I like that. So as we're closing our interview, I just wanted to say, do you have a message for parents that you could share? Because I know there's a lot of parents out there who are struggling with their young people, with their children who are experiencing mental health issues. Do you have a message you could share with them?
Sure. Yeah. I like this rhyme. As you know, I speak in neuroscience rhymes. Where focus goes, neurons grow. So really simply keep it positive. It's a difficult time for you and children and families, but try to keep that focus on the positive, on what your child's doing well, what you're doing well, what the teachers are doing well. Everyone is stressed. And when we make that our focus, where focus goes, neurons grow, we're actually enhancing our capacity of our brain to solve problems, to work together, and to improve our mental health.
So where can people find you, Shimi?
Yeah, my website's drshimikang.com, and Dolphin Kids is dolphinkids.ca. And like I said, we're accepting new counseling patients. We have availabilities on Saturdays and weeknights. And actually, the other thing I forgot to mention, Andrea, it's available in Mandarin, Korean, and Punjabi languages. That was really important to have it multilingual to reach communities, and we're going to be expanding towards more multilingual services.
Excellent. What amazing service. All right. Well, thank you for joining me here today. I definitely want to have you back in the future. I would like to see how Spark Mindset app develops and to learn more about technology and promote your programs, because absolutely astounding. We even have Josh and Gia, who are the kids of Dr. Shimi Kang, as presenters for Stigma-Free Society, 15 or 16. How old is he now?
15 and
Yeah,
11.
and 11. So absolutely astounding. Thank you so much for your support. Good luck at your event today, and take good care of yourself. Thank you, everybody. Have a great day.
Thank you. Thank you for all you do.